Good afternoon. Today I want to talk about a real application of visual analytics for healthcare-associated infections. It is a case study. I will show you a real-world application with a variety of visual analytic techniques. I think, as Ross mentioned early on, visual analytic is a very powerful approach to detect the expected, but more importantly, to discover the unexpected. And it will show us what is going on in the data. So what are healthcare-associated infections? They are infections that patients get when they have surgery and or treatment for some medical condition in a hospital. They can be there as an inpatient or outpatient. You probably have heard of some of them, like MRSA. The problem we face are that increased medical costs because of extended hospital stays. And also is a major cause of morbidity, which is ill health, and mortality, which is death. The healthcare services have logistic and economic problems in managing these infections. The World Health Organization said that this will continue to rise because our hospitals are always crowded. We have more and more people with compromised immune system. We also have new microorganisms and with increased bacterial resistance. So it is a big issue. The infection can be caused by bacteria, viruses, and fungi. So there are a lot of different causes. How do the patient get infected? For example, contact directly between person to person. Indirectly can be just touching a surface that's been contaminated by an infected person. And they can also be airborne, waterborne as well. So it's now increasingly believed that we can actually reduce the infection rate significantly if we practice good hygiene, such as remember to wash our hands and wash them properly, not just a quick rinse. And also be more careful when we prescribe antibiotics, and as well as improving our techniques and devices. And in all circumstances, surveillance is the key factor. So what are our objectives? Our objective here are to monitor infection so that we can detect outbreak. We can achieve this by analyzing and understanding the infection, visually analyze which hospital building, which ward or specialty pose more infection risk, and which have effective infection control strategy or record. We do this by monitoring the patient's status and the movement so that we can detect any anomalies, things that we do not expect, any clusters of patients group, or any patterns. Seasonal could be, geographic, and any relationship between the infection, say gender. Is it gender related? Is it age related? And also look at trends. So this will enable us to detect and identify potential outbreak much more effectively. So try to hold it as soon as we can instead of letting it grow out of proportion. So our data set, this is an example infection. Is spanned over 4 years. We have over 400 patients and with more than 8,000 admissions. And it is related in 10 hospital buildings with 127 wards and 14 medical specialties, which can be dialysis, can be chemo, can be cancer, can be pediatric. And what I want to stress is this is real data. So the data, as some of you might expect, will be in our beloved standard Excel spreadsheet data. Very meaningful, lots of numbers for us. We have the patient identification. We also know when the patient was admitted and discharged from the hospital ward and hospital building and what specialty. Was he admitted for chemo, dialysis, for general surgery, and also the first time the patient was tested positive and the last time that the patient was tested positive. And it's the real data, so we know that it's never going to be perfect, and also it's never being structured and collected the way we want. So we have to work with whatever data we're given. We can't say, no, can't do that. It's not what I want. So we have to live with that. So now I would like to show you some of the data analysis and exploration work that we have done and doing. So why visual analytics? I mentioned earlier on that we have over 8,000 records. and it is impossible for us to understand and assimilate without analyzing it visually. And you can see that even analyzing it visually is challenging. It is impossible if we don't have interactive visualization. So I will show you now a range of example visualization. Some of them are traditional, so you will be familiar with. Some of them are more advanced and sophisticated. But I want to also stress that it is important for us to explore the raw data using a variety of means, something simple method. They are there for a reason. So don't neglect the simple approach. And we need to do that so that we understand our data. We are familiar with the characteristic. We know what is going on in the data. So this is a very simple bar chart, patient admission. We can see that each line, horizontal line, represents a patient, and the color is corresponds to the hospital building where the patient was admitted. Now, what can you see? You can see that there is the number of admissions for the different length of line. The length of line represents the number of admissions. So you can see at a glance that some patients only there once, but we have frequent visitors. So the one at the top with the long line, the one that with the record is over 700 times, so it's a frequent. But using the color, we can also see that the patients are not necessarily admitted to just one hospital building. They are admitted to different hospital buildings. What that's telling us, we can explore that further. So just using a very simple two-dimensional display here, we get information of three features: the patient itself, how many times the patient was admitted, and also which hospital building the patient was admitted to. Now, if we click on the left-hand side, say, okay, this one is may probably have some interesting history. 750 times they've been admitted in the hospital buildings, and we click on that. It will bring out the right-hand side interactively. We see that this patient has been admitted to 4 different hospital buildings, mostly in CH building and less in the WW. So now we give some view that the patient admitted multiple times. They are also not necessarily in the same building, but also not necessarily equally distributed. It depends on, we can infer that by the conditions. So we now look at where have these patients been to? So actually in the CH, they account for more than double the number of admissions, because altogether we have 8,479, and followed by JR and also XG. Now we look at, of these patients, how many of them actually were infected while they were in the hospital? This is what we call in-ward infection. We find that there are only 450 of in-ward inspection at the top, and it's also color-coded, still color-coded by the hospital building. So now we know that just by a look of this, you can see there are a lot of blue in the ward infection. That's what already tells us that it's probably associated very heavily with the JR building. So let us look at it. Actually, it is with JR, or about more than just slightly over half of the 450 were from the JR building. We also then look at what speciality do they associate with it. So these two views are interlinked. We can maybe click on JR, and then you will see all this speciality that has the in-ward infection associated with JR linked to it. So now we understand that JR and ward speciality 2 account for a significant number of the infection. So when did this infection happen? You will find that between 1997 and 2001, that JR peaked at 1998. And you also notice that of the 10 hospital buildings, only 7 of them have in-ward infections. The other 3 didn't have in-ward infection. And so you can also see that JR was also very successful in reducing the infection rate. By 2001, it actually leveling with the other hospital buildings. Now, we also now have to ask us, these other hospital buildings have much lower infection numbers, but they have not managed to reduce it as noticeably as JR. So what is happening there? So we now have some interesting question that we will ask. And we now look at, is there any seasonal patterns across the months, the 12 months in the year? Actually, I can't see that there is any patterns in this particular infection. What about individual hospital buildings? We can see that CH, HG, and JR have infection throughout the whole 12 months, while RI, CI, and WW have months between infection that they have nothing. So we can now see that they actually make two patterns, significant patterns. One is spread right across the year, and one is more sporadic. And we also now look at maybe how many tests are that have been performed for this hospital over the 4 years. And JR has more tests than the other hospitals, buildings. And we also look, maybe we want to look at the infection per day. So here's CH, JR, and HG, the top three. And you can see JR has some clustering, and the others are more spread out. So let's now give you more understanding about what's going on. Now we want to look at, okay, we have all these patients, and they are admitted multiple times, some of them not. And how long do they actually stay in the hospitals? And so now we look using a very simple scatter plot, again is color-coded. We look at the patient along the x-axis, and then the number of days they stay. You can see it's actually very variable. They visit to almost 5 months in the hospital. So you can see now this particular infection has very diverse, variable characteristics. And we want to know, okay, if they stay variable length of the hospital, in the hospital building, how long did they stay in the ward before they get infected? So again, we look at it, and we said some of them were actually infected pretty much when they arrived at the hospital. Some of them were more than a couple of months. So this shows you another characteristics and the patterns of the data. It might not be what you expected, but this is real data. So that is what is interesting is working with real data is that there are a lot of unexpected and interesting information to explore. So far, we have seen able to manage to look at 3 features at a time. And we can do much better than that. Ross mentioned parallel coordinate, which is a very useful technique to analyze high-dimensional multivariate data. So in this example, I just put 6 different features concurrently. You can look at the patient ID, the hospital, the ward. What grouping is the specialty, how long they stay, and how long did they stay before they become infected. So now you can look at that. We highlighted the hospital building CH. You can see that the patients, few patients there, and they were in few different wards, and only 6 ward grouping specialty. They stayed at the lower and the mid-range of the number of days they stay in the hospital, and they also, some of them get infected very quickly after they were admitted in the hospital. Some of them take longer. So that, and if you click on any of this point, we give you highlight. You can look at a particular patient. We know the patient been admitted multiple times, and we can also see that how many times the patient been tested, been infected. So Ross also mentioned link view. We linked a parallel coordinate with a bar chart with a scatter plot, and you can see that it now show you different pattern. And in fact, patterns are more likely to be discovered when they're represented in the multiple ways. And this multiple representation actually also give you more chance to explore data in different aspects. Because each display is tuned for a particular data aspect. And so they're all interlinked. So here we highlighted the CH, and you can see all the information related to it, but you can click on any other plot and any other point, and it would automatically highlight. So this gives a very, very useful tool for you to explore the data very intuitively, very easily, and you can discover a lot of things. For example, over there, you can see that some patients have repeated infection. Does it mean that these repeat patients are more prone to it? or is there other reason? Do they have come from a particular age group, or they are being treated for particular conditions? And also, is it related to a particular year? Because we noticed 1998 was quite a significant increase in JR. So you can see the advantage of exploring data in this way, and we're now getting to know more and more about the characteristics of the data. So far I have shown you some basic characteristics, interesting aspect of the data. For example, JR and what speciality 2 are the sort of culprit for the high incidence of the infection. Now we look at the geotemporal aspect of it. So why are we looking at it? We want to now look at the interaction of the patients with each other. We want to look at the temporal movement of the patient in and out of the hospital building, as well as between wards. Sometimes they change ward, and also looking at how does it relate to maybe spreading the infection. So the system is to enable the infection control personnel to visually analyze the movement of the patient and the status, whether infected, not infected, and also interaction with other patients. And we can filter the data and query individual patients. So this is the interface. The top gray rectangle is the community, is the world outside the hospital. And you can see that we have all the hospital buildings here, and each little rectangle is a ward, and each ward is now color-coded by the ward specialities. So what you can see now is, at a glance, you can see JR actually has the most complex structure. It has 55 wards, 10 speciality. You can also see other hospital buildings that share the same specialities. And you can see some of them only have one ward and one speciality, of course, but it's only for this particular infections. Okay. So this is the control panel. This system can be used for retrospective analysis, which is what I'm showing you now, but also for real-time and surveillance. As the patient coming in, admitted, you can have the analysis and any threshold you want to set up. We can look at all the patients, or we can select patient visibility, that is, we select a subset of patients, because we're looking at infections. So we want to look at maybe patients who were in the hospital 30 days, 10 days before being tested positive, and 10 days or 30 days after being infected. What are their status? What are their movements? And who are they interacting with? We also maybe want to track patient contacts. When the infected patient in the hospital, who were in contact with this infected person, and also did they get infected by this infected person as well. And we also look at infection fade out. This is the ability to allow us to look at the recovery process, to see how long it takes to recover, and we can look at the infectiousness of the infected patient. And I mentioned that we have 400 odd patients. We want to be able to represent individual patients, because otherwise it's meaningless to do any analysis, and want to make it as simple as possible. So we use an icon with a letter and a background. The letter is white when the patient is not infected, healthy. Red when the patient is infected. Pink when the patient is recovering. And that is when we have the fade out gradually from red to pink, and then will be gray. We want to differentiate those patients who have never been infected and those patients who have recovered from an infection. And also we want to draw attention to this new status. When the patient becomes infected, it turns red, but we want to flash it just to get attention for the infection control personnel to look at it or to track this particular patient. And so what we have done here is that the patient outside in the community, you can see that patient F has been admitted from the community into JR in the ward speciality 2. You can also see that patient L has moved from a ward in speciality 2 into another ward. And you can see that we have infected patients in the community as well. So that at a glance will give you the status of all the patients being discharged as well as the patient inside the hospital buildings. So we also can click on the icon of the patient to see the patient details. So for demonstration purpose, I just put the patient ID, but you can get the patient full medical record if you so wish. And this is a detail on demand. You can compare the record between different patients. So now look at the surveillance aspect of it. On the 20th of April, there is no infected patient. There were 7 of them in 4 different hospital buildings of this particular infection. On the 4th of November, we have 2 infected and 26 non-infected patients across the hospital, and we have 125 non-infected and 3 infected patients in the community. On the 28th of November, we actually have 4 infected patients and 2 recovery patients in JR. Now, is that something that we should send alarm? Because we now have altogether about 6 patients with depends on the infection. Some need a lot higher number because it is quite frequent. Some send alarm bells to say, oh, we shouldn't have that many. So that is a part of the surveillance to set a threshold to alert the personnel to say, watch this, you might have to do something about it, isolate the patient or something. And we are altogether we have 344 patients in the community with recover and infected as well. So now we want to filter the patient. We want to look at just subset of the patient. This is very useful when we want to explore the infectious characteristic of the patient. We can change the selected specific set of patient, or we can also look at patient who have short stay or patient have long stay. We will then look at their status when they get infected, who else do they come into contact with, and all the movement of the patient, because they can be moved between wards, they can stay in the same ward, and what specialities they were admitted to or being treated. Here we look at contact tracing. We look at this particular patient. The patient was in contact with 14 contacts during his stay in the hospital, and we want to then be able to track these 14 contacts he had. What were their status? Did they become infected, and where were they in contact with this infected patient? How long were they in contact with this patient? And so we can now have look at very specific. We can call him the lead, the source of the infection, and then try to trace back, track about the status of the people he was in contact with. Were they already infected? Were they became infected after? And how long were they? Does it matter how long they were with him? Because it also depends on how infected he was during the whole period of the time that he stayed. So there are a lot of variables, and there are a lot of interesting area to explore the infectiousness and the characteristics of the patient as well as the infection. So now we'll give you a little. A very brief demonstration. So you can see the patient moving in and out, and by the day. So they're moving, some of them moving between hospitals, some of them being discharged in the hospital, and then you will see some of them waiting for some of the infected. You can see some flashes of the infected patient. You can drill down on that, you can stop it, and then you can explore further about it. So you can see some patients are in contact with non-infected patient, and then we can look at if they were infected. If they were infected, how long did it take? If they weren't infected, why weren't they infected? What are the differentiators between these people? So I would like to conclude to say that visual analytics provide the only practical means of exploring, analyzing, and understanding large and complex raw data set of the patient information. The visualization tool, you can see, can be used with minimal training, and this is very important. no matter how sophisticated your tool is, if it's very difficult to use, nobody is going to use it. It's very important to engage the user in their design and what they how they're doing, how they work, and how they want to use the system. And also you can see that it is impossible to understand and analyze the data in its raw spreadsheet form. And its visualization is essential for analyzing the non-visual spreadsheet data. And beyond graph, more sophisticated techniques such as geotemporal visualization are important, but they become more specialized and more difficult to implement. However, so visual analytics provide an effective and intuitive means for exploring data to detect trends, cluster recurring events. I also want to say that although what I have shown you is for health application, this has wide application in the defense, in finance, in security. Use your imagination. Thank you.